Welcome to Heads and Tails, the podcast where midlife gets a major reframe. Let's be real. Midlife can shake up everything. Your relationships, your career, your connection to your kids, your parents, even your own body. Perimenopause, menopause, shifting identities, it can feel overwhelming, like a full-on crisis. But here's the thing, it doesn't have to be. We're here to help you flip the script from midlife crisis to midlife recalibration. I'm Dr. Kate White, gynecologist, menopause, and sexual medicine specialist. And I'm with Jay White, marriage and family therapist, and my husband of 26 years. Together, we're diving into all things midlife, from your head to your tail, to help you find more connection, more clarity, and a whole lot more joy. Let's get into it. So today's show is about something that I deal with every single day, and I think you deal with a lot as well, because it's the change of our midlife sex life. And that is such a big part of intimacy and connection in relationships. So I think we just start with, I'll ask you some questions about what you see, and then you can ask me some questions about what I see, and then how we deal with these things every day.
Sounds good.
All right.
Fire away.
So when you have patients that come in, or patients, clients, whatever you call them, come into counseling, and certainly this is an issue that comes up, differences in how their sex life has changed.
Oh, okay.
And so how is that, what do you see in therapy as interfering with that sex drive? Or
the group that you're talking about would be someone that's been, a couple that's been married a long time. And when I say long-term relationship, as some say it's 15 years and up.
Do you know what it is clinically when we look at it as a sexual medicine doctor? 6 months.
It's a long-term relationship?
Your sex drive and sexual connection starts changing after a 6-month relationship.
Oh, well, I can see that, yeah. In the, and we could, that's funny, because you can compare it to because from my study, when couples are most likely to break up.
Yeah, let's look at it that way.
And it will be 6 months is one of them, because the sheen has worn off, the magic, that this person's not perfect anymore. A year and a half. And that is when people, I think, ask the question, is this the one?
Right.
Does that make sense? And and then it would be the
fish or cut bait, if you want to say it in
fish or cut bait, right? It's just the clinical terms.
Yeah.
And then you have for some reason 5 years, and I think that's, man, we're into this, and should I have been? It's amazing how many, and I don't want to run down too many paths, but how many couples I will get where they will say, after 4 or 5 years of marriage and a child, or I mean, it's tragic, but they just say, when I was walking down the aisle at my wedding, I knew this was, something was off.
But they thought they could make it right.
I can make it right. I can make it right. So switching gears to what you're asking, and that is let's take that's interesting. 6 months is a long-term relationship. But all right, let's say a couple has been married for 15 to 35, 40 years, something like that. And the changes that take place, wow, because I'm basically going to fire the same question at you. But to me, there's a breakdown in connection. There's if there's a bad change, if there's a real problem, there's a breakdown in connection. And boy, when you get people in couples counseling, it's delicate, but they can all, they're not always delicate, but they can all tell you, this is the problem I have with that person. They can all say, this is what I don't, and sometimes they say it with, they're animated. And certainly they've said those kind of things at home, but the problem is the person gets defensive, the person shuts down, the person fires back. I mean.
Right. And sometimes it's a long list.
And sometimes it's a long list. Yeah, that's true. If you're thinking of your own list, no. But it is a starting point, and but it's tough to be productive with that. And there's almost no way to do it at home. You're asking so much of people. I mean, it's hard to do in therapy with a referee. I mean, so one question that I've come up with that you can do at home. And of course, we're bringing up these topics, but we're also trying to come up with solutions. One question that I've come up with is what can I do? And let's follow this to its end, because it seems strong at first, but you say, what can I do to be more attractive for my mate? I'm not
so you're
attractive
kind of flipping it around, because
you're
most people probably come in saying, that person is annoying me.
Yeah,
so
and here's why.
And here's why. And what that person is because you were at some point ostensibly attracted to this person.
Yeah.
And you are getting to the point where this person, for whatever reason, their behavior, their
attitudes,
the attitudes are no longer attractive to you.
Correct.
And so you're flipping it around to say, hey, maybe we should look at yourself first.
Right.
To say, why am I no longer attractive to my partner? Or
well, it puts you in control,
mm-hmm.
and you can do this without actually fixing the big problem. I mean, and so in other words, you can ask yourself, not that I want to be, but
right.
if.
If I were to want to be,
if I wanted it, to be more attractive to my mate, here's what I would do.
And by attractive, it's not necessarily physically attractive.
Correct. Because that's where people go. Sorry, I cut you off.
Absolutely.
Yeah, that's where people go. And so they will say, I will get couples saying, well, I guess I would get more wrinkle cream. I guess I would
hit the gym.
I would hit the gym. I would, and it's so much fun, because I always ask the woman to answer first. And now, if it's a gay couple, then I get to it's 50-50. But I always ask the woman first, and I tell the man, you have to be quiet. You cannot make any facial expression. I mean, poker face. Mm-hmm. Let her answer, and he'll say, and so he'll sit there, and people will still make faces, but she'll say, yeah, it'll be hit the gym, or it will be, I guess I could like your mother better than I do, and what's wonderful is, first of all, guys don't care about wrinkle cream. That's for y'all. I don't, no guy cares about that. But the at the end, he will look at her, and once it's vice versa, he'll look and not understand anything she's just said. And he'll say, none of that is important. You know what the number one answer is? I want her to be happy and kind. Now, the guy, there's usually a longer list.
That's a tall order sometimes.
Yeah, I know. And these are the two things I am not, or I'm not in the mood to be. Mm-hmm. And it is, so how do we get there? The good thing, and then with the guys, they'll say, I have to, I don't know, maybe she wants me to work more. Maybe she wants me to help take out the garbage more, maybe. And it won't be that. It'll be, I want you to be nicer to the kids. I want you to sit down for 6 minutes with them and play without telling them anything they're doing wrong. I mean, and once you get there, it's funny. Once you've said the things that you think would make you more attractive, and you're wrong, or I should say, even if you're wrong, or maybe especially if you're wrong, it's amazing how much more willing they are to hear what their spouse has to say. No, that's not it at all. Because now you've checked some things off the list.
And addressed some of their own anxieties about themselves.
Correct. And you've just said, no. I've had one guy, first of all, I'm just in 20 years, I've had one guy say, I wish she'd work out more, or I wish she'd hit the gym, or one. And you know what's funny? She did. She said, you're right. All right. I was like, yeah. I know, because I was expecting fireworks.
My work here is done.
Okay, I'm done. So y'all, and they had great insurance. It was fun. I'm just kidding. All right. So for you, it's funny. I have basically the same question. It would be, where did my libido go? And how things like anxiety or irritability or what is it that you hear? What is in your
absolutely.
office? I mean, and
I think a lot of the same thing. If they're in your office, it's because they want it to work.
Okay.
And for the vast majority of my patients as well, they want it to work. They want to be sexually attractive to and have spontaneous desire for their partner. That's why they bring it up to me, because and they did have that, and now they're missing it, and they don't understand why that things have become difficult, and so there's so many things that do play into that. Certainly, perimenopause, menopause, you see that, and being in a long-term relationship, plus all the complexity of everything else going on in your life, that and stressors, you see let's just say anxiety. Anxiety increases by 30 to 50% in perimenopause. And a lot of people, as a result, get put on SSRIs, which aren't necessarily the wrong thing for some people, but one side effect of that is it can kill your libido and your orgasm capacity. And that is a big, big problem. But there are also problems with just those changing hormones. You've got everything affecting.
And this starts when?
So when we look at midlife and perimenopause, it really, people are shocked that it really is starting in your mid-30s. And right when your life is getting more and more complicated.
Right.
And so you've got the estrogen and progesterone fluctuations at much wider amplitudes. So you're going from a gentle wave to a tidal wave, especially as you get closer, further along in your early 40s.
So a tidal wave of
estrogen and progesterone changes, instead of going from from these small peaks and valleys, you've got these tremendous spikes of hormones. And when you come down from that, you're getting changes on estrogen and receptors in the brain that affect your amygdala, which is going to be your area that's looking at fight or flight, and you're constantly on in preparing for disaster, and so whether that disaster is, did my kids remember to their homework, or if it is. Am I going to be able to get this project done, or do I need to go to the grocery store and do 5 other things before I go to bed tonight? And so by the time you get to the point where you potentially would be wanting to have sex, if you think about it physiologically, in general, sex is for reproduction. And if you're looking at the ideal time for you to reproduce in an anthropologic way, you want your stress levels to be low, because you don't want to produce a child into a high stress environment. And so if your stress levels are high, your libido is naturally going to be low. So if you're in a situation or hormonally where you're at where your brain chemistry is making you more anxious, plus situationally things are busy, and then the last thing that you want to do is have sex, because that is just how we are made to be. In general, for men, sex is a stress reliever, and can be for women as well, but that spontaneous desire is going to be down-regulated when that stress level is high. Okay,
and we have so a couple of things there's a lot there.
Yeah.
No, but that's good. No, it all made sense. It was all linear. That made sense. And what we call now midlife, I guess we should talk about a little bit. What is midlife? And I looked this up, and it's funny because I've always thought it's funny that I'm 57 and we call it midlife, and am I going to live to be 114? But it's not that. It's not the middle of your life. It's the middle of your adult life. So it would be, and I liked the definitions. It was fun to kind of look at, but it said 30s and 40s would be, and it's amazing that we call that early adulthood. You can say 20s and 30s. And then 40s, 50s, 60s, or just 50s, 60s be midlife. And so that's usually, and then 70s and 80s. would be later life.
But I think
and then,
functionally, midlife really for us, because of the changes that are really dramatic in women for sure, and somewhat in men as well, that it really is, I would say, it starts at 35.
Okay,
and
so 35, and certainly by 40,
absolutely.
Perimenopause, and
Yes.
you're starting to see
Yeah.
Okay.
So,
All right.
but back to just how do you deal with that? How do you get that connection? How do you regain that drive, and how do you get that spontaneous desire back? And some of it is what you said, is like trying to make that connection to what things would make that come back for me. Is it a matter of just recognizing that when my stress is high, it's natural. First of all, I think people feel better that it's natural. That's normal. This is what is supposed to happen physiologically when your stress levels are high. But just to say, okay, well then let me see if that persists for me, if I can get to a point where I make an effort to really have trysts with my partner, where we say, okay, we're going to take... So
define trysts.
A tryst would be that...
I mean, I know what it is, but tell them. Yes,
for everyone that's not Jay White. So when you're looking at a tryst is that spontaneous... when you would get that spontaneous feeling of, hey, let's run off and do this. Let's go grab a drink here. And how exciting it was at the beginning of your relationship when you would be able to have that intimacy. It's just the two of you in this together. At that whole beginning of your relationship, where you had that excitement of the newness,
right.
How do you regain that? And so, it really is going to be taking a little bit more of that effort to get yourself outside of that stressful situation. And is that going to happen 3 times a week? Maybe not. But I think that in order to reframe that in your head to say, okay, it's normal for me to not have a huge amount of libido. And I will probably have to work on possibly managing the hormone levels so I'm not in these big swings, and recognizing that time, especially in perimenopause, that week before your period, is the worst because your hormone levels are crashing.
Right.
You're irritable with everyone, and talking about that with your partner and saying, hey, during this time, I know that I am going to say things that I don't mean, or be irritable in a particular way, and this is what I need from you during this period. This is the kind of support I'm going to need.
So communication,
and that would be over to you. Tell me about how how would you restart communication if that communication is now...
You really did have a question on communication.
I did really have it, yeah.
Wow.
So, yeah.
That segue.
It's just professional right here. But how would you restart that communication if it is completely gone to hell?
Okay. Wow, that's a good question. All right. Usually when I'm talking about communication with an individual, or certainly a couple, I start with the 3 ways that people communicate poorly. One is to talk in code. So you will, sort of like your dad does, where it's, I wish I had a glass on the table with some water in it. Would you like a glass of water? It would be, talking in, we sure are eating out a lot. Would you like to eat at home more? Or are you saying we're spending too much? You see what I'm saying? So it's sort of, it's
making your partner guess
what
it's
hidden in there. And there are reasons that we do that. I mean, there are defensive reasons that we do that, because we can't be shut down if we're not really saying it. I mean, it's kind of there was a fraternity brother of mine that the way he would ask a girl out is he would say, I had a dream about you, a dream you were in. And if she showed interest, he would continue. He's completely making it up. I mean, he'd say, but if they go, that's weird. No, it wasn't. I mean, it was just, I guess it was about the class or something. And then he could just walk away. So it's kind of that, again, code speak. The other one would be translating, which is the opposite of code speak. That is when somebody says something and you translate it. So that would be something like, we should start eating healthier. And the other person says, are you calling me fat? Or something.
Yeah,
no, whoa.
You're saying,
I'm not going anywhere. And that's not what I was saying. I'm saying we should eat healthier. And so it can, that can cause it. And then the third way is just to not communicate. Like you say, that's just where you completely shut down. Avoidance. You don't say it at all. And all three have the reason that so many people do one or two or all three is because it's defense mechanism. I mean, it's man, I don't want to.
If you're fighting all the time.
Yeah, I don't want to fight again. I don't want to borrow more trouble. I don't.
So you start out with poor communication, and that basically leads to no communication, is what you're saying. And so, so if someone's in my office or your office, especially around sexual health, to restart that communication can be really difficult. If you've got two people at a standoff in your office, what would you say would be a good way for them to start back with trying to get back to where they were 15 years ago when they felt they
or at least and nobody's in their 20s anymore that well, I'm sorry, the people that are in their 20s are they're right there, they're right where they should be in their 20s,
right.
But if you are, a midlife couple, and this also works for, I don't want it to make it sound like that we're only talking about long-term relationships, 15 years or 6 months, 15 years or more. This also works for somebody that's been divorced and now they're remarried and they're 53 and they've been married for 5 years. I mean, all this works exactly the same. Or let's look at the definition of intimacy. So I think sort of having sex or sexual activity would be, that's the home run, I guess that's why we call it that. But you're never going to get there if you don't even want to sit and hold their hand or have a conversation and this is where I've always liked the thought of we're never more than 3 sentences away from healing a relationship. We're never, or starting to heal a relationship. If you say, I know that I have not given you my best. I know that I have been distant and there is a lot going on and it is not right that I have taken it out on you. If you start with something like that and then you continue to, can we go to dinner? Can we take the kids to your mom's house? Can we just go to dinner and talk? That's, you've done a lot.
So if you said you're no more than 3 sentences away from your healing a relationship, that's really can be really powerful. So it gives them a tool of saying, okay, let me reframe this. Let me think about, I know that my stress has been impacting how I feel. I know that we have different needs at this point, and for that our sexual relationship, I would like to regain the intimacy that we had. Something like that, where
exactly.
And so it's a lot of I statements. It sounds like when you're saying about it, it's like a lot of how I statements, and not necessarily saying what I need, what you need to do. But and so it really would be a lot involving some introspection. over what's going on with you, which I do think is important, but also connecting in a way that says this is important to me, and you are important to me.
Yes.
I think that can be one of the things. And these are the things, and really being able to say, this is what I need from you, which can be very difficult, especially when we're talking about sexual intimacy. And I think it's very important to one of the things that you said, that sexual intimacy is not what we call PIV, or depending on who your partner is. But I think that a lot of times we think of sexual activity as just penis and vagina. We can say that because it's a podcast, right? So whereas penis and vagina is, like you said, that's the end. Yeah. The end point for most people.
Right.
But when we look at, and I think we've got a lot of, one of my dear colleague friends, Laura Mintz, who wrote the fantastic book Becoming Clitorate. She did a great lecture at the Menopause Society talking about this same kind of intimacy issue, and talking about how horrible the terminology we have around sexual activity is. We talk about foreplay, which as if that's not sex. You know, they say, and I think a lot of kids are raised to think, oh, well, if you have oral sex, then that's not sex, especially if you grew up around the time of Bill Clinton. But and then these things that it's a failure if you don't get to the point of PIV sex, where that is what sex is. Whereas, as you said, intimacy and hand holding and cuddling and touching and making out, and just like a pat on the hiney in the kitchen, that is sex, and it can be sex, and it's all
that
part.
Counts as sex.
Yeah.
We have sex 10 times a day.
That's right. So, but I think that reframing how you think about your sexual relationship is not necessarily always end in an orgasm. It may be that it is some physical touch that is more intimate touch, especially, and we can go into these other things about during your changing capacity. There's lots of things that change.
Well, that's what I wanted to ask. We're segueing so well. All right, and we have about 8 minutes or something like that. But I want to touch on this real fast, because you have mentioned, and since you have mentioned it, I have noticed that it is it's far more common than I thought it was. And I don't know, I'm a dude, and so I don't keep up with, but the question of why does sex hurt now, or what? So the physical changes. So talk a little bit about that.
Absolutely.
Talk about a possible solution.
Sure.
Where somebody can start, because man, now that I have mentioned that, I have had friends that say, their wife has mentioned, and it's not every time.
Sure.
And again,
so when we look at the physiologic changes, and there are so many physiologic changes that happen in your brain in terms of spontaneous desire and the desire center, and and then testosterone changes and estrogen changes that can diminish your spontaneous desire. But nothing is going to diminish your spontaneous desire like having painful intercourse.
Right.
And when you have painful intercourse, what's causing that? A lot of the time, you get changes in the tissue of the clitoris and the vagina that are affected by decreases in estrogen and testosterone. But one of the most common is that lack of estrogen. And it's not, we see it, and some of my patients see it even when they're when their estrogen levels are low at any point with in breastfeeding, you can get that same sort of vaginal dryness changes. And if you did have it in breastfeeding, you're definitely going to have it when your estrogen is much, much lower in perimenopause and menopause. Some of my patients have it cyclically just when their estrogen levels are low in that time right before their period in perimenopause. And
okay, so that's why it would hurt sometimes.
So one of the reasons is that the tissue gets thinner, it gets more sensitive, and very few people, and a lot of times if they go to their doctor and they do talk to it, they're like, oh, just use a lubricant, you'll be fine, here's some coconut oil, blah, blah. But really, why are we not addressing the actual changes to the tissue? Because there's, in fact...
And what would help that?
Well, the American Academy, American Urological Academy, just came out with new guidelines about using vaginal estrogen, and the ACOG, which is American, and they all have guidelines that say local vaginal estrogen is safe. It does not increase the risk of breast cancer. It does not increase the risk of strokes. It does not increase the risk of blood clots. It decreases the chance of recurrent UTIs by 50%. When we look at admissions to the hospital, and this is going beyond the value of it for sexual activity, but if we look at it, it is a local vaginal estrogen around the tissue of the vagina and the urethra, which is right there, and vagina and bladder too. It decreases the chances of recurrent UTI. Why is that important? Because if we look at about 25% of admissions to the hospital for women over 60 are due to UTI-related events, and the changes of the lack of estrogen and how it affects the tissue of the labia, which are supposed to be protecting the urethra from bacteria getting in, and the tissue of the urethra itself gets less bulky and less able to keep those bacteria out. And so you can see mental status changes, and you can see things that look like dementia in older women, and that can lead to urosepsis and death. So if you want to save a life, get your mom on some vaginal estrogen today. But and when we were in residency, we only were taught to look at the benefits of vaginal estrogen. We would ask patients, oh, are you having sex? Are you having pain with sex? Oh, you might need some vaginal estrogen. Never was it addressed that this is something to maintain the tissue, to maintain your health and your life. And so I have patients who have pain just walking around with their vulva being dry and thin. And so, and just a little topical vaginal estrogen, and there's lots of different, there's creams, there's pills, there's a ring, there's, any way you want it that you could probably get it.
I feel a lot more comfortable talking about my stuff.
Yes. Well, that's not true, because we talk about vaginal estrogen at our table all the time. Right? I mean,
our kids are so lucky.
They are so lucky. But there's DHEA. There's different things that you can use in the vagina, and so that being able, and once you get that pain, manage that pain. Yes, you're going to get your desire center will be like, oh, it's not going to hurt. But the other thing that happens is you can get muscular pain because once you get some of that pain, your muscles of the vagina start getting tense. And then, so a lot of times I'll work with my patients not only on the vaginal changes of the superficial tissue, but also on the muscular changes in the muscular pain that they can have. And until that happens, no one's going to want to have sex.
Right.
So you do have to reframe for a lot of times for patients. How to have that intimacy and how to have sex, because
reframe.
Yes, because
I thought you said refrain.
Well, sometimes refrain, but usually, but if your goal is to have that penis and vagina sex again, then we can use vaginal dilators and work with a pelvic physical therapist. But in the meantime, be able to start communication about, hey, there are other things we can have. We can have outer course, which is stimulating each other with the physical, because about 65% of women have primarily clitoral orgasms. It was put on the outside for a reason, right? The reason why your clitoris is outside is so that you'll be willing to put that thing on the inside. So when we look at, there's a small percentage of people that only have get orgasm from penetration, but the vast majority of people have primarily clitoral orgasms. So that what we called foreplay and stimulation helps
should just be called sex.
Should be just called sex, and that should be a way to reframe in your in your relationship and what sex means and how to really be able to say, yes, lubricants are great. I'm all for lubricants, but make sure that you're also protecting the tissue, because there is no one essentially that shouldn't be able to use some vaginal estrogen. I know we're probably getting towards it, but there's...
Yeah, and what a way to end the show.
Oh, I know. I do want to say just one more thing.
Okay.
Is that when we talk about caring for each other and are changing roles in each other's lives, a lot of times we do get to be more of a caregiver and have some of that, especially if one of you or both of you has had some medical problems, looking at cancer, looking at erectile dysfunction. Right. Because that is another thing, is trying to develop that if the more that you're a caregiver, the less that you are a lover. And so when you're constantly feeling like a wife and a mother and packing lunches and things, you're not feeling that sexual identity, and that can be a real problem. And then if you have a partner who is struggling with his own issues, and you feel like you are trying to support them, and in that way, you may feel less of that sexual relationship that you had, and it
turns into somebody you feel like you're taking care of, or an additional child or something.
Yes,
and. Well, go ahead.
And I think that's when you have to try to reframe your relationship and try to get to where that intimacy went off course, and how to think of this person and yourself again as a sexual being, and try to make sure that you can go back to and really have to reignite in your own mind where was I comfortable as a sexual person? Where was our relationship more of a sexual relationship and less of the mommy relationship? Which right.
And we're just touching on. I mean, we're just scratching the surface.
No, each of these things could be a whole show.
Well, right. But of
we haven't even gone into insomnia and sex.
Listen. We will do. Get ready. We'll do many more sex shows. But and that sounded weird. But
snoring and sex. That's a big one.
Yeah. I mean, but we're just touching on. This is what can be improved psychologically. This is what can be improved physically. Let's end it there, and then we'll pick it up another time from the same subject and position and so forth. Is that all you had to say about that?
Listen.
We could keep going, but
the main things we would say we're looking at that. If I wanted to say what are my take homes, to say that it's completely natural to have that relationship shift and change, and for spontaneous desire to be diminished after in any long-term relationship, and it's okay to have that decrease in spontaneous desire and still have desire, but not expect that you wouldn't necessarily that in how we're living our lives and how our brains are shifting, that spontaneous desire is going to be there all the time, and have that communication with your partner to say, hey, I think that we're going to have to work a little bit harder to get to that point where our stress both is more
and what
managed.
can I do, and what
and
is
then
it
look
that I
at
can
you,
do?
and then the next thing would be look at myself and say, like you said, how can I be more attractive to my partner? But also, how can I communicate that what my needs are from my partner?
And honest communication, not going in circles
honest
and
communication,
so
and not talking around each other. Oh yeah,
we're going to do the coin flip, and if it's heads and tails, and then it's heads, so I get to ask a question.
Okay. You have to have one ready to fire, dude.
Here's a fun one. If there were an extra day of the week for the rest of the year that no one knew about except you, So we'll call it Wursday, or something like that. So as day in between Wednesday and Thursday, you have 24 hours. It's just you. Everyone else is sort of frozen. What would you do with your day?
I would finish all my labs. Sign those off. Sign off my labs.
Oh, no. I thought it would be, I would garden.
No, I would get to that. I would say I would
finish all my labs.
Sign off all my labs, and then. But yeah, I think that it would be. I am such an extrovert that time on my own is not really my my ideal. I actually do love working in the garden and thinking, and that is probably my most. My most positive mental reflect is working in the yard and garden and connecting to the ground in that way. But I think I would say I want to get everything else that takes my time away from
During
the
week.
time that
you're with people.
Correct.
That you
I would
are
say
with
I would
people.
get rid of all the things that keep me from being with my friends, being with my partner, enjoying that social time that makes the connections. I really need those connections to people, and so I would get rid of all the stuff that I don't have to that takes me away from that.
Don't forget to like and subscribe or follow, and depending on the platform you're listening to this, and if you're listening to this on YouTube, please leave a comment, and the comment can be it can be, God, Kate is so lucky, or it can be a question that you have, or it can be something you want to hear more about. Anyway, this will not be our last podcast on intimacy, but anyway, I appreciate everybody's time, appreciate your time, and we'll see you next time.
All right. Heads and tails. Bring love back to life.
There you go. The information on this podcast is for information and entertainment purposes only. While it is true that we are a doctor and a therapist, we are not your doctor or your therapist. This program does not diagnose or treat you. It is not intended to substitute for the advice of a physician, professional coach, psychotherapist, or other qualified professional. Thank you for listening, and as always, take care of yourself from your head to your tail. See you again soon.